This week we're going to dig into some private types of insurance you might come across. We'll hit a few big broad categories of private insurance types. First we'll go over health maintenance organizations, or HMOs, and we'll talk a little bit about preferred provider organizations, or PPOs, and then we'll hit consumer directed health plans. So first, our health maintenance organization are HMOs. So if you're under an HMO, all your medical providers are under contract with that insurance company. So with that insurance company, your primary care physician might be contracted with them. This goes for specialists as well, specialist cardiologists, neurologists, anything you can think of. They're all under a contract with this private insurer to provide care to their beneficiaries. With your HMOs, you will have to select a pre-approved primary care physician, and this primary care physician is going to act as a gatekeeper for other specialists. So you have a little bit of chest pain, you might go to your primary care physician and get a referral to a cardiologist, and you can't go to that cardiologist before you get the referral. So they act as that gatekeeper. They hold the permission slips, but you have to go through your primary care physician first. If you go straight to that cardiologist, anything done with that cardiologist, even if they see you, will be all on your shoulders. None of your insurance coverage will cover that visit. So referrals are required for all specialist consultations, but the trade-off with that, you're going to see lower premiums, lower deductibles with your HMO plans. Now, HMOs come in a few different types of makeups. So we've got a staff model, a group model, and a point of service model with your HMO. The staff model, not completely common anymore, but under the staff model, physicians, these medical providers, are directly employed by the insurer. So the HMO is directly employing these physicians to provide service for them. The group model is probably the most common that we'll come across. Under this group model of the HMO, the insurer is contracting with medical groups. So physician groups they're contracting with to provide that medical care. This is the most common you're going to see. So under the group model, the physicians aren't directly employed by, let's say, Aetna or Blue Cross Blue Shield. Instead, that HMO is contracting with various medical providers to provide service. Under point of service, this kind of transitions us a little bit into our PPO plans, but under point of service, it's an HMO plan that does allow out of um, network providers. So if you want to go see cardiologist B instead of the referred cardiologist A, you can go ahead and do so, but it'll just carry a larger price for you. Usually a higher copay, maybe higher deductibles if you're going out of network, but under the point of service model, those out of network physicians and medical providers are still allowed. Like I said, that transitions us nicely into preferred provider organizations. PPOs, these are probably one of the more common insurance types out there. You're probably on a PPO, is my guess. Under PPOs, still contracts with medical providers, but they're in-network and they're out-of-network providers. Your insurer, say Blue Cross Blue Shield, will provide you with a list or searchable link you can pull up online to search who's in service, not in service, in network, and who is out of network. So you can go ahead and go see whoever you'd like, but co-payments are going to be different for in-network versus out-of-network. Deductibles might be different in-network versus out-of-network. Unlike HMOs, under a PPO, you do not need to select your primary care physician. A lot of insurers actually will allow you to choose a primary care physician and mark it down on paper that I'm going to see Dr. Smith as my primary care physician, and then give you a little bit of a discount on your monthly premiums if you do select a primary care physician. Under PPOs, you do not need referrals. Again, you have that list of in-network versus out-of-network physicians, medical providers, specialists. So as long as you're choosing the in-network physicians, you'll be paying that lower copay. If you decide to go out of network, you'll be paying a higher copay. In contrast to HMOs, So you don't need referrals, and you don't need to choose a primary care physician. And you have in-network where you're allowed out-of-network providers. You're going to see some higher premiums in comparison to HMO. You're going to see higher deductibles in comparisons to HMOs. Now that brings us to our third broad category of private insurance types. These are the consumer-directed health plans. You might see it abbreviated CDHP. So consumer-directed health plans have become popular probably in the last 20 years or so. And you'll see them come in two flavors, and the best health plans under this broad category combine these two flavors. So both a high deductible plan and a health savings account. So with these high deductible plans, you have very low premiums, but you have very high deductibles. This is considered catastrophic coverage. So I have enough money, and I am um, risk loving enough to say that I can afford to go to my physician once a year for my checkup, and maybe once a year when I get a sinus infection or I catch the flu. And that's all I'm going to need. So all I really need is coverage for that unknown, that big unknown event, that big car crash, maybe that big heart attack that I just didn't see coming, something big. So I trade off these low premiums for a high deductible. So I pay very little per month, but I have a very high deductible. And all I needed it to do is to cover me for that car crash I don't see coming, and I might rack up a $50,000 trauma bill. So this high deductible plan is going to cover me for that, but I don't need a $20 copay for my physician's visit. I can cover that primary care physician cost on my own. So we pair that with this health savings account, and these health savings accounts are drawn usually pre-tax, almost always pre-tax, out of your paycheck. Goes into your health savings account, and you can use this account for qualified medical expenses. And there are lists all over the internet, and depending on the insurer, you can go to each insurer's website, and they will list what a qualified medical expense is. So I can use this health savings account to go to my primary care physician. So I can determine and define how much money I want to be taken out of each of my paychecks and put into this account to cover my medical costs, like those physician's visits, maybe even going to the convenience store and buying aspirin, buying other prescription medications. I can use these for, so long as they're qualified medical expenses as defined by your insurer. Also, with a health savings account, these funds roll over year to year. So I have a high deductible plan, and then I have a health savings account. If I don't use up that HSA each year, that's fine, because those funds, maybe I have a couple $100 left in that account at the end of the year, and that couple $100 will just roll on over into next year, and I can keep on rolling. Now these consumer-directed health plans sound very appealing, and very appealing especially to younger, more healthy populations. There are some benefits and some downsides to it. Consumer-directed health plans as a whole have been found to decrease moral hazard. And remember, if you think back to maybe one of those health economics lectures, we talked about moral hazard, and are we using more than we would or we should, given the cost and the price of that good. And we talked about, yes, health insurance increases moral hazard, but not all of moral hazard is bad in that context. So under these consumer-directed health plans, we decrease moral hazard. If you're under one of these plans, you're less likely to go to the physician, even if you're sick and need the physician. So you're just less likely to consume medical and healthcare products. So there's a decrease in preventative care. I might not even just go to the physician once a year for my annual checkup. I might skip that completely just to save $75. And then people who buy these health plans tend not to get all of the information they need, and just say they just need a high deductible catastrophic coverage plan. So we found that about 2/3 of people with consumer-directed health plans don't have a health savings account. So all they have is that catastrophic coverage, and everything else is completely out of pocket, and it's after-tax money that they're spending. It's not that pre-tax that goes into the HSA. A newer insurance type, organizational type that we've seen. This came out of the Affordable Care Act, or accountable care organizations. It's not really an insurance type in and of itself. This is for Medicare beneficiaries, and it's really kind of HMO 2.0. So think of it as an HMO for Medicare beneficiaries, and accountable care organizations can be brought together, organized by a group of medical providers. And this is really a coordination of medical providers across disciplines, across the spectrum, all the way from cardiologists to social workers. So providers all across the spectrum come together and they are paid under a capitated fee schedule. And so they are paid per patient no matter what the cost to the organization is to provide health care for that patient. Again, these are just for Medicare patients. You'll see these have popped up here and there. Some regions have more ACOs than others, but kind of HMO 2.0 for Medicare patients, just these provider groups coalescing, coming together to care for individual patients. So we've hit the big types of private insurance that are out there, the HMOs, your PPOs, your consumer-directed health plans. So let's shift focus a little bit back to EMS and ambulance operations and talk about some EMS membership programs that you'll see flowing out there. Maybe an organization you've worked for or the organization you currently work for has a membership program. So the idea behind these is that private insurance, how do they reimburse us as EMS providers and organizations? They typically follow Medicare, Medicaid rules for transport, but there are a wide range of copays. Patient A's private insurance copay for an ambulance transport might be $100, while patient B's copay might be $500. So there's a wide range of copays, and what we typically do as EMS organizations is bill the insurance company, the private insurance company, and whatever is left over on that bill, we send over to the patient. So the patient is responsible for whatever the insurance company is not covering. Taking all that into account, a number of EMS organizations, usually the larger ones, have started offering membership plans. So the argument is that EMS use is unpredictable. I don't know when I'm going to get into that car accident. I don't know when I'm going to have that stroke. So whenever I need to call a 911 ambulance, it's unpredictable and I can't I don't know when it's gonna happen. And then I look at my insurance coverage and my copay is pretty high. So I have a $300 copay for an ambulance ride, and then the insurer might cover another $500, but if I am billed $1,200 for that ambulance ride, well, that I still have a good chunk of money left over to cover myself. So what can I do? I can purchase this special membership plan through my local EMS agency. All EMS membership programs are going to follow the same principles. The small little details are going to be slightly different, but broadly they're going to be fairly similar. So I call 911, I get an ambulance. That EMS organization bills my insurance company. I pay my copay. My insurance company reimburses the EMS organization whatever they reimburse them, and whatever is left over, instead of me receiving the bill for the leftover amount, sometimes it's wiped away completely. Sometimes I get a discount. So here for LifeNet, if I have their membership plan, right, and I get a 40% discount on whatever is left over. And if I have Medicare, well then I'm done, right? There is a EMS membership program here in Wake County in North Carolina, and for $60 a year, you and all your family members residing at the same residence, whatever is left over on that bill is completely wiped away. So these membership programs are all pretty similar, but some small details. Some wipe the rest of the bill completely away, and some give you a pretty deep discount on the remainder of the bill. No discussion on EMS reimbursement and insurance structures would be complete without mentioning the brand new, shiny new car smell emergency triage treat transport model. It's come out from CMS for Medicare patients, so the ET3 model. Instead of talking myself to death and you having to listen to my voice over and over and over again for hours on end, I have posted the overview seminar, webinar video up on Blackboard for you for ET3. It comes straight from CMS, so you're getting the information straight from them. There's also some good resources for you up in Blackboard about the ET3 model. If you or your organization is thinking about starting a pilot program with the ET3, lots of resources there for you. And as always, if you have any questions, comments, concerns, even cuss words, please feel free to send them our way.